Hi there, my name is Naomi Joffe, and I'm a psychologist at Cincinnati Children's Hospital. I'm really excited to be here with you today to talk a little bit about living and coping with Fanconi Anemia. I hope that this presentation can be applicable to folks and helpful. And so if you have questions as we're going along, please do hold on to them so we can talk about them when we have time together in a little bit. So first, we'll just go over some introductions. I want to talk a little bit about my role as a pediatric psychologist and what we do to support patients and families. We'll talk a little bit about some common challenges for diagnosis and treatment for our families managing a chronic condition, specifically Fanconi Anemia, and also some approaches to coping. And I'll have you work through a little exercise with me to hopefully give you something that we can kind of leave here today with to try at home. I'm generally a fairly informal presenter, so since you can't interrupt me, again, if there are things that come up, questions, comments, anything like that, hold on to it so we can talk about it together in a bit. A lot of our literature on family and patient coping is based on families with a patient who has an oncology diagnosis. Some of that is replicable or applicable and generalizable to our FA families, but not all of it. So there's very limited literature, which I'm sure you are more aware of than I am, on child and parent coping in families of patients with FA. And so I've pulled what we do know and tried to include it here, but I like to just kind of reference that gap in the literature and that there is more work that needs to be done. So a pediatric psychologist, some of you may be familiar with folks in my position, others not. Psychologists in the community generally focus on mental health and mental illness, whereas a pediatric psychologist focuses on the physical health of children and the relationship between psychological and behavioral factors and their health, illness, and disease. So we work with individuals who have physical health problems, and we work to support those patients and their families in what we consider normal challenges that come along with having a chronic condition. What is normal is that having a chronic illness is challenging, and so we are here to support patients and families as they are dealing with things as they're coming up. I'm embedded within our hematology oncology transplant department, and work primarily specifically with those populations. And we work with our families while they're inpatient, when they're in clinic outpatient, and once they're assigned to one of our providers, our psychologist providers, that psychologist sticks with that family while they're with us for treatment. Some of our common reasons for referral: adjustment to diagnosis or treatment, working with families around, I consider this one, having trouble doing the things that the medical team is suggesting or recommending that they do, that we know are not always easy things to do. That's something that looks very different, whether we're working with a 5-year-old or a 15-year-old, and whether they're inpatient or outpatient, but that's something that we support families around a lot. We support patients around mood concerns, whether it's related to their chronic condition or life in general. We do pain management when that's relevant. We also here work a lot with caregivers, and so we know that a lot of our families, particularly when they're here for transplant, are away from their primary support systems. And being a caregiver on this journey with the patient is one of the more difficult things that an individual could be going through. And we want to continue to support our caregivers so they can be the wonderful caregivers that they are as they're moving with their child through this journey. So that's something that we enjoy as part of our job. We also do a fair amount of behavior management. How do we parent in the context of having this child with this chronic illness who's now inpatient for 30 days, things like that. Because, right, managing behavior is already a challenge when children aren't faced with the things that they're faced with a chronic illness. And so this adds a whole nother kind of level of complexity. I also like, normally when I'm in a situation like this, I really like to hear from my audience in terms of who here is here with me. I know that this is a diverse group, so everyone who's here, your life has been impacted, right, by the diagnosis of Fanconi anemia. But I know we have parents, we have other caregivers, we have adult patients here, a variety of ages, and I'm sure a whole host of different experiences in terms of how individuals were diagnosed, the medical experiences they've had, how they've been impacted by their illness, treatments they've needed. So I think it's just important to recognize I've had the opportunity to work with a fair number of families at Cincinnati Children's who've been impacted by FA, and know that I still have a lot to learn about our families' experiences in terms of the range of the stressors they face, how they're managing their illness, how it's impacting their quality of life and their families coping, strategies that our families have found helpful in dealing with stressors as they come up. And so one of the reasons it's important to me to recognize the diversity in this group is that I want to do my best in trying to, again, make this relevant for everyone who's here, but I also know that the people are in different places, and so I'll do my best. So as a pediatric psychologist, we're always thinking about our patients within their family system, within their greater context. And so we have our individual, and we know that they have their primary support circle. And then there's a whole web, a whole connection of people that we don't get to see and we don't get to meet oftentimes that are part of their world. This is important because what happens to one family member impacts others in that system. And we know that everyone's impacted differently. And so events that might seem challenging or feel really difficult for one individual might be very different for someone else in that same system. We also know that all of this is happening for families within the trajectory of development. And so patients' emotional and behavioral challenges when they're 5 are going to be very different than their challenges at 10, and then those again when they're 20. And so we're often talking to families about that and trying to think about our patients in that context. What's difficult for a child might be different than what's difficult for their caregiver. Children often describe more in the moment things, right? I'm having a painful procedure. I don't look and feel like myself right now. I'm having to miss out on things that my friends are getting to do, and it's not fair. Whereas parents are often thinking longer term. What are some of the things that may happen to my child in the future? What are the things that I'm anticipating they are going to be missing out on? Feeling some grief and loss for those things, and for that lack of control that our families with FA are facing. And so the ways that we kind of cope as patients and as caregivers may look different, because our contexts are different and how we're viewing things is different. So we'll talk here about what we know are some common challenges for patients and families. Some of these may be familiar. This is not an exhaustive list. There are lots that aren't included here. We know that FA is often an unfamiliar diagnosis for our families. So parents and caregivers are immediately kind of faced with, what does this mean for my child? What's the treatment? What's the prognosis? How does this impact them long term? Our families are having to grapple with just a huge amount of information as soon as this is on the table. So it's not just the diagnosis alone, it's all of the, how do I get my mind around this idea that is something that I may not have had any exposure to before. We know that in addition to our patients and caregivers having to do that oftentimes in the same way, FA is not known to the greater community. And so then what that means is that our families are having to explain their diagnosis to their loved ones at home, to schools, to friends, and it can be hard for family and friends not to understand really what this family is having to deal with. Even when someone has a diagnosis like asthma or cancer that might be more common in the world in terms of what people have been exposed to, people think they understand, they still probably don't understand, but the idea of having to teach this again and again can be exhausting to families. It can also sometimes lead to it being harder to get support because the onus is on the family to have to continually explain their child's condition and then what the family's needs are. We also know that the course of the illness is variable, right? This is true for one individual and also between individuals. It changes over time. It's different from one person to another. And it can be really, there can be a strong pull to want to find similar kind of examples in the community from one patient to the next. And it can be really hard to not compare. And yet we know that every individual is different. And so that isn't always helpful. And that's something that families sometimes describe to me. We know that family members cope in different ways. So I can tell you that I rarely meet one family that all has the same approach to coping. It would be so much easier. My job would be way easier, right? Your lives would be way easier if we all cope the same way within our families, but we rarely do. So what's more common, and even if this is just a piece of coping, I think about how much information we want in the medical setting. And in one family, we may have one individual who says, I only want to know what I need to know to deal with today or to deal with this week. Like, what's happening right now? What do I need to do right now? If you tell me X, Y, and Z and where this is going and what the plan is and all of those things, I get very, very, very overwhelmed, and then I am not going to be coping well. In that same family, we have another individual who says, I need to know what medications we're on. I need to know the long-term potential side effects. I need to know what our plan is for the rest of the year. I need to know all of the different potential roads that we could be going down, right? And both of those are fine approaches to coping. What is problematic, we know, is that if, like, we as the medical team are giving too much information to the first person, or we're not giving enough information to the second person, then we're going to impact their coping negatively. But it can be really difficult within families not to get irritated at others' approaches to coping. So that's something that can be a challenge in terms of one person perceiving that the other doesn't care about an individual's health, or someone perceiving that someone's being anal and paying too much attention to detail when it doesn't matter. And so something that can be challenging is those differences. And then something that I would say is probably, from what patients and families tell me and what we do know from the literature, the significant uncertainty that our families face, and the waiting that our families face, whether it is for more information or for a transplant or for what's next. I'd say those are probably the bigger challenges. As a species, we generally do well when we know what we're dealing with, how big is the hill we have to climb. We can usually get our minds around it and be successful. It's harder when we have significant uncertainty and don't know exactly what it is that we're dealing with. So, I'm curious whether some of these are consistent with your experience, what we're missing. Other challenges, again, this is not an exhaustive list, right? I think about all the domains that people can be impacted when they have a chronic illness or when their child does, whether it's socially, academically, emotionally, physically. And then I thought, let's talk a little bit about some of the things that might help, that could be helpful. So I start here. Let me start by saying, I sometimes joke about with families that it's really easy for me to give recommendations. I give recommendations all day long, right? But when it comes to putting those things into action, what I know and what I can recognize is that is a whole different ball of wax, right? In my life, in your life, it's easy to give recommendations. It's harder to take those steps. But I think it's still important to start there and then see what's important. What can we do? So thinking first about our adult patients and our caregivers. I think we talked a little bit about those differences in coping. I think it can be helpful to consider how our loved ones are responding to this chronic illness through the lens of approaches to coping, right? So if we can tell ourselves, okay, the reason that they don't want information is because they get too overwhelmed and they need to live in the moment, then that can be helpful in terms of both respecting that kind of those boundaries for them, and then also not feeling as angry and upset in terms of putting ideas out there like you don't care or you're not being thoughtful, when it's really just this different approach to coping. For our parents, focusing on that relationship is something that can often be really challenging when supporting a child with a chronic condition. So thinking about little ways, can we have a coffee date as we're passing each other in the hospital? Are there ways that we can spend, even if it's a 10-minute period where maybe we assign ourselves a topic to talk about that is not our child and their health, but just finding ways to connect, even if it's small little ways and looks different than it may have at one point in time, to give ourselves kind of that ongoing relationship piece. Then that idea of being patient. How am I doing today? What are we doing today? Okay, well, we have to deal with tomorrow, but right now we're doing okay. And allowing yourself to take that kind of one day at a time. For our children, we know that children with chronic illness do best when their parents maintain as much kind of normal parenting as they can. So we know that chronic illness is going to do everything that it can to get in the way of that. But thinking about, how do I maintain some type of routine for our family? What are the things that can be constants even as we have all these moving pieces and parts? We know that maintaining normal expectations for behavior can be very challenging when we know our child is not feeling well or is having to undergo treatment. But we also know from patients that are old enough to be verbal, they'll say things when they have a chronic illness like, gosh, my mom let me get away with this. I must really be sick, right? And so by being the wonderful parents that you are and having those expectations for them that you know they can reach, then you're sending the message that, okay, we're doing okay. You've got this, right? You're okay, right? Because I have these expectations for you and I know you can live up to them. Something else that can be really challenging for families is having opportunities for mastery and control. These often come through our jobs or through school, and those can get disrupted with chronic illness. So thinking about, what are the ways that I can support my child in having a hobby so they can feel like they're completing tasks and gaining knowledge and skills to support their coping overall, even in the face of all, again, these moving parts. So, like we said, a challenge can be kind of, what do we do and how do we move forward in the face of that uncertainty? Chronic illness can get very big, right? Oftentimes in life, what's normal is that we have multiple identities. We are a mother, we're a father, we're a brother, we're a friend, we're a wife, we're an employee, right? We're lots of different things. And when we're dealing with chronic illness, our patient identity or our caregiver identity can kind of like balloon, and those other things can shrink. And that usually doesn't feel great. So one thing we can do is we can take some time and try to think about kind of, what is important to me right now? What are the things that, if I really kind of check in with myself, that my mind says important, that my heart says important, what is important to me, whether that's been my focus or not? I think about values as kind of the direction that we wish to move. So almost like east on a compass, right? A goal is something that we can check off. So I want to go to Chicago. I can check that off, right? But I want to move in a certain direction. That's a value. And so if we can identify our values, what's important, it can help us move towards what's important to us, even as we're facing this uncertainty and challenges and frustration and worry. There are lots of benefits to feeling like we're moving towards our values, towards those things that are important to our core. Gives us purpose. It can make us feel like we're making progress, even as parts of our lives aren't moving like we'd like them to. It can be easier to make decisions when we kind of check in with what's important. Values are something that there's no right or wrong. They change. They're different for if everyone in the room did this exercise, our values would be different, and they would change for each of us over time. So it's really with checking in with ourselves kind of right now in the moment. So here, since we have this time together, I thought we could take a few minutes today to kind of make this more of an actionable idea. So these are just like 16 values. Okay, there are many, many more. You could probably come up with some fairly easily. But these can kind of just get us started in asking kind of, who do I want to be right now? What strengths or traits, qualities do I want to kind of develop in myself right now? What do I want to stand for right now? These can feel like really big questions and overwhelming in the face of all the other things that we're dealing with. So we're going to break it down a little bit. And I'm going to use myself as an example since I can't call on anyone. You lucked out today, okay? Let's start by identifying which of these values speak to us right now. So I want you to just look through this list, or maybe something else popped your head, and think about one or two things. If you have a piece of paper, you could jot them down. But think about if any of these kind of jump out as, I'm kind of connecting to that, okay? So let's say, let me get myself organized over here. Thank you for your patience with me. Okay. Let's say that I picked family and health. Okay. So the first thing that I'm going to do, and you can do this along with me, or you can do this later today, is think about, what does this value mean to me, right? What does this look like? If I had to just pick a few words or phrases to describe like what family in my mind means, if I were living it consistently with my values, what would that look like? So for me, that would be this sense of connection, feeling mutual support, like I was helping them and they were helping me. Okay, just a couple thoughts. It doesn't have to like be forever, but just think about, what does family mean to me? It's going to mean something different to me than the person next to me. Health, I think about having energy. I think about feeling strong. I probably think about feeling less fatigued, right? Doing things that are good for my body. And then the next thing we want to do after we've kind of defined those values as we see them for ourselves is ask, it feels like I'm connecting to this one, but like, how important is this to me on a scale of like 1 to 10? So 1's, not important, right? There may have been times when family was pretty unimportant. Right now, how important is this to me? 10 being, this is really, really kind of central to my being. So let's say I give family a 9, okay? Pretty important, right? Let's say I give health an 8. The next thing I want to do is say, so how successful do I feel with this value? How successful am I being right now in kind of like living this value each day? And this is something that like is to be done. It's like we're noticing, right? We're trying to do this without judgment. We're not trying to be hard on ourselves. What we know is that there is always room to grow in terms of moving towards the things that are important. And so this is an opportunity for us to kind of check in and figure out, where do we want to go next? So let's say I'm an 8 with family. I'm pretty good. I'm feeling connected. We've had the quarantine. We spent lots of time together. People are feeling supported. Okay, that's great. Maybe for health, I'm like at a 4. Okay, so more of a discrepancy, and that is like a really good opportunity, an indicator to say, hey, this is something that maybe it's really important to me, but I don't feel as successful. I can work on movement there. So I might ask then, what's one thing I can do today to move toward this value? And I bet if I opened this up to you guys, you would have lots of great ideas. I want this to be something small. As humans, we set large goals that are too big more often than not. The idea is that if we are moving toward this value, if we are going east, we're making progress. Okay, so what is one thing I can do today to move toward this value? Maybe it's Maybe I park my car farther away from my doctor's appointment, so I have to take more steps, moving towards the value. Okay? I'm closer towards health than I was before I did that. Maybe it's filling up my water bottle in the morning and saying I have to drink this before I go to bed. Maybe it's finding my tennis shoes, right? Because then tomorrow I can choose something else. I can make one more step that will move me closer toward that value. So you guys can think about this yourselves. What areas might you want to give more attention to, right? What's one thing that you could do today that would move you closer in that domain, in that value, to where you want to be? Again, catching ourselves when we say, I didn't do enough, or I didn't move forward. Trying to think about, maybe I'm setting the alarm on my phone, and one time today my alarm's going to go off, and I'm going to take a minute to stretch. Okay, what are the things that I can do to move myself toward that value? And trying to do so without judgment. Again, it's the idea of like not how far I moved or how fast I moved, but did I move? Did I take a step in that direction? So just kind of in summary here, that idea of taking care of yourself, some of these are things that are, again, easy to say and that we've all heard before, but that we can revisit, and they're opportunities to help us be supported as we're going through something challenging. So engaging in those self-care activities, thinking about how those fit in with your values and what might be consistent and support moving in that direction, thinking about those different identities and how we can fill those roles. Maybe friendship's important to me and I haven't been able to give it much attention at all. Can I send someone a text message today, right? What can I do that's going to just put a little more air into that balloon and help me feel a little more balanced? Seeking accepting support from peers, right? And so that can be hard to do sometimes, but helpful. We know we didn't talk today about kind of the experience of trauma within our families of individuals with chronic illness, but we know that medical traumatic stress is something that many individuals who are dealing with chronic illness themselves or caregivers of individual chronic illness are facing. And so we have a lot of evidence in the research to suggest that writing about trauma, talking about trauma, allows our brain to process that experience, and through processing that experience, it's less likely to have kind of a negative impact on our mental health, our coping, and our mood. So looking for opportunities to do that, whether it's through professional support or even writing about it in your own personal life. So I thank you so much for your time today. I'm really glad that I get to be here with you, and I'm open to talking more about any of these things. Thanks so much.